Well, good morning. Welcome to the subcommittee. Subcommittee will come to order. I want to welcome everyone to today's hearing. We have, looks like, got a nice turnout for this hearing, and we're pleased to have the new Commissioner FDA, Dr. Scott Gottlieb, testifying before the subcommittee today. Dr. Gottlieb, welcome. You are no stranger to the Food and Drug Administration or the Department of Health and Human Services. You have served in various leadership roles and on committees that make you well qualified to lead the Food and Drug Administration. Again, welcome to our subcommittee, and we look forward to working not only with you, but also with your team as we move forward with the budget process. The intent of this hearing is to examine, of course, the Food and Drug Administration's FY18 budget request. In addition to this committee's review of the budget request, the members of the subcommittee will seek information on the agency's use of current and past resources, including the activities, policies, and practices supported with appropriated funds. As I've mentioned in my previous hearings, we have established 4 primary goals for this subcommittee as we progress through the 2018 appropriations year. The first goal is evaluating and accounting for taxpayer dollars to assure efficiency and accountability. Number 2, investing in rural infrastructure as a catalyst for growth. 3, to ensure support for American farmers, ranchers, and producers. And last, and probably most pertinent to FDA, protecting the health and safety of people, plants, and animals. Congress has passed a number of noteworthy pieces of legislation over the past 10 years involving FDA's role and responsibilities. Included in this would be the Tobacco Control Act, the Food Safety and Modernization Act, the Food and Drug Administration Safety and Innovation Act, the Drug and Quality and Security Act, and most recently the 21st Century Cures Act. Each of these major acts has resulted in new funding streams and a constant need for the Appropriations Committee to increase our oversight of the agency. Our oversight not only covers the expenditure of resources, but also the corresponding action, the efficiency in delivering those actions, and the degree in which the agency delivered or failed to deliver meaningful and measurable outcomes. At the end of the day, our constituents demand that limited resources are spent wisely. FDA's FY18 budget request is not unlike any other budgets this year from other agencies because it is the administration proposes to scale back some of the activities and to decrease the spending. As I reminded everyone at the budget hearing yesterday when we had Secretary Perdue here, our nation's debt is unsustainable as it will exceed $20 trillion. And of course, that's 20 trillion with the T. In terms of your funding request, FDA is proposing a total of $4.9 billion at the program level for its salaries and expense account. Of this total, $3.1 billion is delivered from user fees and $1.8 billion comes from discretionary budget authority. This change in budget authority represents a decrease of $939 million. While the budget proposes to recoup $769 million from additional user fees, the agency is proposing a reduction of $171 million. We will likely have questions and comments about these proposed changes and some of the budget gimmicks of yesterday and that we're even seeing today. And looking at the proposed user fees, FDA is again proposing to collect and spend $725 million in renegotiated user fees for the drugs, medical devices, generic drugs, and biosimilar user fee accounts. I give someone credit for coming up with a very creative proposal. But the legislation before Congress reflects agreements that take up to 2 years to work out. You are asking the authorizing committee to reopen their nearly finished product and renegotiate over $700 million in user fees without additional benefit in return. These reauthorizations need to be complete by July, or as I understand it, FDA will begin the process of reducing their medical product review staff. At a time when the administration is talking about speeding up medical product reviews, it would not help to lay off the very people you need to complete those reviews. Lastly, I'm skeptical of FDA's reopening user fee agreements for unexpired animal drug user fees to recoup an additional $53 million. This is a long way of saying that the agency's chances of offsetting budget authority with user fees face a very steep uphill battle in the future. FDA oversees 20 cents of every consumer dollar, resulting in one of the safest medical product markets and the safest, most highly productive food and agricultural sectors in the world. The United States government plays a unique role ensuring that all of these sectors maintain their current vitality. We must continue to explore ways by which the FDA can fulfill its public health mission successfully, but do so in a way that the regulated industry has clarity on the rules of the road and they are not burdened with unnecessary regulation. On a related note, I would like to express my appreciation for the FDA's recent decision to review the previous administration's regulatory actions. Your agency can achieve the same ends as those required by Congress, but without the costly and burdensome means of some FDA's previous regulatory action. I look forward to hearing about the agency's new priorities, as well as the continuation of past priorities, such as the reducing of opioid abuse, or your progress in implementing the provisions of the Food Safety Modernization Act. We expect to hear more about the planned changes to the medical product review process, the agency's recent fast approval of the cancer drug Keytruda may indicate FDA's greater willingness to utilize the latest medical advances to improve your regulatory process and make drugs accessible prior to the completion of a lengthy drug trial. Also want to open up a dialogue about the orphan product review process so that Congress can determine whether underlying law or administrative changes are necessary to weed out the unscrupulous actors in the space. At the end of the day, we want to hear from you that resources are adequately aligned with policies that will advance public health. As I and my colleagues are keenly aware, the work you and your colleagues perform at FDA touches the lives of every American. And we appreciate the dedicated service not only you make, but also your entire team makes. You have no shortage of work, as there are many challenges that face the Food and Drug Administration today, from drug safety and effectiveness to opioid abuse to animal and food safety, feed safety, just to name a few. We will look forward to hearing from you today about the President's budget proposal and what you're doing with the newly approved resources in the current year. So at this time, I would like to ask Mr. Sanford Bishop, who is our ranking member from Georgia, if he has any open remarks that he would like to make. Mr. Bishop.
Thank you very much, Mr. Chairman, and welcome to you, Commissioner Gottlieb. Mr. Chairman, I'm pleased to be back here again today as we have our subcommittee's second hearing on the administration's budget request released on Tuesday. It also gives me great pleasure to welcome Commissioner Gottlieb before the subcommittee today. Your background as an internist trained at Mount Sinai School of Medicine and policy expertise are impressive and will no doubt help you in executing the wide variety of responsibilities as the FDA Commissioner. We have a big job ahead of us, and I look forward to working with you in order to help FDA fulfill its mission of protecting the public health by ensuring the safety, efficacy, and security of human and veterinary drugs, biological products, and medical devices, and by ensuring the safety of our nation's food supply and cosmetics. Mr. Chairman, I'm very concerned about the impact of the proposed budget before us. It proposes replacing all of the discretionary budget authority that currently funds medical product reviews, largely for drugs and devices, with user fees, which would reduce discretionary spending by $769 million. Because the user fee reauthorizations are very far along in the legislative process on the authorizing side, it's doubtful whether these fees would be authorized for 2018, resulting in a $769 million hole in the FDA's budget. Also, the proposed budget cuts $174 million, mostly in the food safety arena, and specifically this affects state and local health organizations that play key roles in education and inspection, as well as international work geared towards raising the food safety standards of countries and companies that export to the U.S., and as such, these cuts would walk back much of the progress made in food safety over the last 5 to 6 years. We simply cannot afford to go backwards in food safety, and the proposal before us would lead us in that direction, I'm afraid. Commissioner Gottlieb, I look forward to working with you, Mr. Chairman, our subcommittee, our colleagues in both the House and the Senate, to fill the holes that this budget presents and to ensure the safety of our nation's drugs, food supply, and cosmetics. Mr. Chairman, thank you for the opportunity to welcome the Commissioner and share my concerns, and I'm delighted to yield back.
Thank you, Mr. Bishop. Also, this morning, join us. We have the ranking member of the Full Appropriations Committee, Ms. Lowy. She is with us. I'd like to recognize her for any open statements.
And I thank you, Mr. Chairman. I do thank Chairman Aderholt, Ranking Member Bishop, for holding this hearing. And I am delighted to welcome Commissioner Gottlieb. You have such an extraordinary responsibility, and I know the passion of all the members on this committee, and so we look forward to working closely with you. Congratulations. The FDA regulates more than $2.4 trillion worth of products consumed by Americans, including food, cosmetics, prescription drugs, medical devices, and tobacco. That amounts to Americans spending about 20 cents of every dollar on FDA-regulated products. Existing sequestration caps for the fiscal year 2018 appropriation bills are already insufficient and would lead to reduction in services that American families and communities need, like a robust FDA to ensure the safety of our food supply and other consumer products. It's time for a new budget deal to end sequestration once and for all. And yet, the Trump budget would cut $54 billion from non-defense discretionary programs, threatening the health and safety of Americans and putting crucial government services such as the FDA at risk. By relying on user fees, which have not been authorized by Congress, the Trump fiscal year 2018 budget proposal would, in effect, cut $943 million from FDA's discretionary authority. This astounding 34% cut would do a great deal of harm, slowing the approval process of drugs qualified to come to market, or pressuring researchers to approve items that, if additional staff or resources were available, might necessitate more in-depth review. This budget would certainly inhibit FDA's ability to implement the new 21st Century Cures Act, combat a growing opioid epidemic, curb antibiotic resistance, enforce crucial public health regulations on tobacco products. We cannot allow these national priorities to go to the wayside in order to meet an arbitrary spending cap or to pay for a wasteful, unnecessary border wall. Before I close, I'd like to note my concern about FDA's recent announcement to delay enforcement of the tobacco deeming rule for 3 months. This decision seems to encourage tobacco companies to use a new playbook, to engage in litigation in hopes of achieving a regulatory delay. I sincerely hope the FDA, whose central mission is to protect public health, will not allow itself to be bullied by the tobacco lobby. So I look forward to discussing this topic more during my questions. I look forward to working with you. You have an extremely important responsibility, and I know how committed the colleagues are, both sides of the aisle, to your success. So thank you very much. Thank you so much, Mr. Chairman.
Thank you, Ms. Lowy. Dr. Gottlieb, without objection, your entire written testimony will be included in the record, and at this time, we'd like to recognize you for your opening statement, and then after that, we'll proceed with the questions. So the floor is yours.
Thanks a lot, Chairman Aderholt, Ranking Member Bishop. I appreciate the opportunity to testify before the committee today regarding the President's budget. I've been in my new role at FDA for 2 weeks, and I'm eager to have the opportunity to work with members of this committee to ensure that FDA has the resources it needs to fulfill its critical mission to protect and promote the public health. FDA values our partnership with Congress in this committee, and we very much appreciate the funding that you've provided for fiscal year 2017. As a physician, a cancer survivor, and a father, I know personally the importance of FDA's role in improving and protecting the lives of Americans. More than $2.4 trillion annually, roughly 20 cents of every dollar, are spent by consumers on products that FDA regulates. The President's budget recognizes our significant public health challenges and opportunities. FDA's fiscal year 2018 budget requests $5.1 billion, a nearly 10% increase over the fiscal year 2017 continuing resolution funding level. I look forward to discussing with you how FDA's budget will support the agency's key priorities. Based on my discussions with members of Congress about your concerns, I want to focus on one of those key priorities in my opening remarks today. That's the issue of how FDA can take steps to make the market for prescription drugs more competitive and help increase access to the medicines that your constituents rely on. Simply put, too many patients are priced out of the medicines they need. While FDA does not play a direct role in drug pricing, we can take steps to facilitate entry of lower-cost alternatives to the market and increase competition. This is especially true when it comes to safe and effective generic medicines. Towards these goals, we're working on a drug competition action plan that I'll unveil soon. We believe FDA can be doing even more to improve our processes and communication with generic drug developers, both individually during the drug development process and through more helpful guidance documents. We believe better and more frequent dialogue can make the generic review process more efficient and make it easier for applicants to bring generic products to the market for a broader range of drugs. At the same time, FDA also needs to take steps to make sure its regulatory processes are not being used inappropriately in ways that take advantage of patients. To these ends, we want to do 3 things. First, curtail gaming by industry of our regulations, which can extend monopoly periods beyond the time frame Congress intended, hindering competition. Second, improve the processes that enable generic versions of complex drugs to be approved for marketing. And finally, increase the overall efficiency of the generic drug review process while completely eliminating the backlog of generic applications, something that requires action on the part of both FDA and the generic drug industry. FDA has an important role to play in preserving the balance between innovation and access and making sure that its statutory and regulatory processes are working as intended and not being manipulated in ways that FDA and Congress didn't intend. For example, we will be announcing soon a public meeting to solicit input on situations where manipulation occurs so that we can assess the ways our regulatory processes may not properly balance innovation with competition as Congress intended. For example, we know that processes related to the REMS, which are intended to ensure that certain drug products are used safely, are sometimes used in ways to slow generic competition. We're going to be taking steps to address this. To this end, we're evaluating ways to streamline the process FDA uses to determine whether to waive the requirement that a generic drug applicant and brand company share a single system for assuring safe use. We're asking, can FDA waive this requirement more readily than we have in the past in situations where sponsors cannot reach agreement after a reasonable period of time on implementation of a shared system? We also want to take steps to improve the overall efficiency of the generic drug review process to help increase product competition. This includes additional guidance to reduce the multiple cycles of review that generic drugs often undergo before their applications can be approved. We also want to increase transparency in those cases where competition is absent by highlighting situations where off-patent drugs lack approved generic competitors. We believe greater transparency in these circumstances can help entice competitors into the market. To provide such transparency, we'll publish a list of those drugs that are off-patent but for which FDA has not approved a single generic applicant, and we'll update this list regularly. We'll consider whether we can provide further transparency by disclosing additional information to help generic manufacturers target drugs with little or no market competition. In closing, current law strikes a delicate balance and a critical balance between drug innovation and access. New drug innovation is essential. It creates new and improved therapies. But access to lower-cost alternatives once the market protections that Congress intended to have lapsed is equally and essentially important to the protection and promotion of the nation's public health. With your support and the resources outlined in the President's budget, FDA is poised to take on these and other challenges and opportunities with our public health mission. From improving patient access and choice when it comes to medicines they take, to implementing the 21st Century Cures Law, to continuing implementation of FSMA, the resources proposed in the President's budget and provided by this committee are critical for carrying out the public health mission you and your constituents are counting on us to fulfill. I look forward to discussing these and other issues with the committee today and working together with you to fulfill FDA's critical public health mission. I'm happy to answer any questions you have.
Thank you. We're just looking at the discussion about the vote schedule this morning. It looks like, of course, today is designated as a day for members to fly out to their respective districts. So they're moving votes earlier in the day than usual. So it looks like late morning we will probably be called for votes, which will keep us on the floor for about an hour. So what we're going to try to do is to go ahead and make sure everybody gets around. We're going to do 4 minutes for each member to have, so that we can be sure to at least get everybody to get at least one round before we have to leave for votes being called. So with that, I'll begin. As I mentioned in my opening statement, you're certainly very familiar with the Food and Drug Administration, its functions and responsibilities. And I foresee you agreeing with some of the policies of the last administration, but disagreeing with some of the other policies. You and your team have an opportunity to define your vision and your priorities for the agency itself. If you could take just a brief moment to tell us what you believe the top 3 most pressing issues that you and your team hope to address as the new FDA commissioner.
Thank you for the question, Congressman. I've outlined some of my top priorities in a talk I gave to the entire FDA staff about 2 weeks ago when I came on board. I'm going to be focusing very hard on the problem of addiction to opioids, looking at places where we can address the issue of high-cost drugs. While FDA doesn't have a direct role in drug pricing, we do have a role to play in trying to bring competition to the market, and also looking at places where we can help facilitate more innovation by looking at the regulatory rules that we create, making sure that they're efficient, they're science-based, they're modern and up-to-date. And in that regard, I plan to use the 21st Century Cures Act as really a touchstone and a strategic plan to help guide our implementation of policies that can help facilitate innovation. Just to back up on the first issue, if I may, I talked about the second in my opening remarks. 2 days ago, we announced the beginning of an initiative to try to address the opioid addiction crisis. And where I think FDA has a critical role to play is on the new addiction problem. We know that most people who are going to become addicted to opioids are going to first be exposed to opioids through a legitimate prescription that they'll receive from a physician. But a certain percentage of people who receive an opioid prescription are going to go on to be addicted to the products. And so what we need to do as a matter of public health is make sure that patients are only getting exposed to opioids in appropriate clinical circumstances and only for the appropriate duration that's needed. So no more 30-day prescriptions for tooth extractions. We think that there are steps we can take to help facilitate these goals, and that's going to be the focus of mine.
Okay. All right. Let me move on quickly since time is running out. In the President's first speech to a joint session of Congress in March, he called the drug review process slow and burdensome. You too voiced concerns about the pace of drug development and the length of time it takes to get human drugs to the patient. Your FY18 budget, as well as your testimony, your written testimony, also indicate that you have ideas of how the agency can make the process more efficient. And there's a quote in your testimony that says, improved regulatory science and policies will not only lead to more efficient approvals and increased completion that can help reduce costs to consumers, but more importantly, they will improve patient outcomes. Could you give a quick summary of how you might speed up development costs, which will deliver reduced costs to consumers, improved outcomes, and maintain the gold standard for safety and effectiveness?
Congressman, I believe that there are parts of the agency that work exceptionally well and have implemented Congress's laws like the breakthrough therapy pathway in a very robust fashion. And I'd single out the Oncology division, which I think has been very forward-leaning with respect to some of the new legislative authorities and how it's implemented them. Unfortunately, as in any organization, there's not always uniform adoption of those kinds of principles. And so one of my goals would be to try to make sure that there's uniform adoption of the principles that Congress has outlined in laws like the creation of the Breakthrough Therapies Pathway. I think another critical goal in this regard in trying to help facilitate new innovations coming to market is just to make sure that the regulatory tools that we're using, the science that's informing our regulatory decision-making, is as modern and up-to-date as possible, so that we have the right metrics by which we're judging the safety and effectiveness of products. So this might mean things like looking at different kinds of trial designs, as Congress outlined in the 21st Century Cures Act. It might mean looking at new scientific tools that could be used to help judge efficacy and safety and help make our process even more rigorous, like the use of modern biomarkers, another thing that's outlined in the 21st Century Cures Act. So these are the kinds of ideas that I think can help facilitate new innovations coming to market and lower the cost of the development process.
Okay. All right, Mr. Bishop, and I understand you want to refer to Ms. Lowy?
Yes.
Okay.
I'd like to yield to the ranking member
Okay.
of the full committee. She has some very responsibilities. She's riding circuit on appropriations hearings this morning, and I'd like to defer to her so that she can get on to her next stop.
Okay.
Thank you. Thank you, my friend. I understand, Dr. Gottlieb, you served on the board of directors of Cure, a vaping retailer. During your confirmation, you stated you would sell your investment in the company. Have you done so?
I have, Congresswoman.
To be clear, you no longer have any financial interest in vaping or any tobacco products you now regulate, including investments or other deferred compensation, correct?
I was fully divested from all my holdings the day I was sworn in.
Thank you very much. Last week, the Appropriations Committee welcomed several NIH directors, including National Institute on Drug Abuse Director Volko. You, who confirmed that e-cigarettes used to deliver nicotine are an addictive substance and a gateway for teenagers to use tobacco. Here's what Dr. Volko had to say, quote, "Teenagers that otherwise would have no transition into smoking combustible tobacco are doing so after they first get exposed to electronic cigarettes. So we are concerned that all of the advances we've done on prevention of smoking may be lost by the accessibility of these electronic cigarette devices," end quote. The FDA recently delayed enforcement of its tobacco deeming rule for 3 months. I really hope the administration will not back off from enforcing this law at a time when e-cigarettes are the most commonly used tobacco product among kids. For years, I've seen efforts by the tobacco industry to change or weaken the deeming rule, and FDA has stood strong with the science and the public health. Commissioner Gottlieb, will you commit to preserve and fully implement the deeming rule, including through the courts if need be?
Congresswoman, thanks for the question. I share your concerns around the youth use of e-cigarettes. And as you know, the issue of youth initiation when looking at reduced harm products is a mandatory consideration as part of our regulatory process. I've been on the job now 2 weeks. In those 2 weeks, I've spent probably 6 collective hours with the leadership of the Tobacco Center and met with them for about 2 hours on my first day because I'm concerned about this issue and I take it very seriously. I will confess that in that time, given the fact that this is a new statute for me and the Tobacco Center didn't exist last time I was at the agency, most of that time has been spent basically going through 101 briefings and coming up to speed on the issue and not discussing the policy going forward. But I will assure you that anything we do with respect to the policy and the regulatory infrastructure that's going to be in place is going to be science-based and is going to be designed in a way to make sure we're maximally achieving the public health goals set out by Congress in this regard and creating a sustainable infrastructure for doing that. I'm committed to this goal. I'm not going to preside over a period of time when teenage smoking went back up in this country. As a cancer survivor and a physician, that's not going to be my legacy in this position, and I'm committed to that.
Just in closing, as a father, would you be comfortable with your children having such easy access to e-cigarettes and other flavored tobacco products?
Congresswoman, as a father, I'm not comfortable with any child being started on a nicotine product.
And I hope you'll keep that thought in mind in your new role. Millions of teenagers now have easy access to these products, and if the FDA does not do its job, these numbers will continue to rise, and we will face a new epidemic of addictive substances that threaten the public health of our children. Thank you very much, and thank you, Mr. Chairman, and thank you, my friend.
Mr. Harris?
Thank you very much, and thank you, Dr. Gottlieb, for being with us today. And I know we have limited time, so I'm just going to briefly run through a group of topics that are of interest to me, and then you can comment at the, at the end, perhaps. Look, everyone agrees that we don't want teenagers to start a bad habit with regards to e-cigarettes. But it's clearly, I think, no one is suggesting that it be legal for these products to be sold to children. And we certainly have to acknowledge, as I think Public Health England has, that there is definitely some use to tobacco vapor products to break the cycle of addiction to combustible cigarettes for adults. And I know we all know people who have been able to use these products, vapor products, in order to break the addiction to combustible cigarettes, which is certainly more harmful. One other issue is the dietary fiber issue, which is a complicated issue. Obviously, the food manufacturers are concerned that the deadline for compliance is fast approaching. It's difficult. It's the products into which dietary fiber is added are an immense number of products. There are labeling issues, all kinds of things. I just want to make sure that I'd like you to make sure that the manufacturers have the ability to comply with these. Look, they want to comply with the laws, but there have to be realistic time frames so that we don't harm manufacturers, we don't harm industry with these well-intentioned rules. With regards to sodium, I know I've mentioned this in the past. And I know the FDA will issue guidance based on the DRI review. I just hope that the DRI review is scientifically founded and realizes that extreme restrictions on sodium would be harmful to some people. Restrictions on sodium in general, large amounts of sodium, is probably a good thing, but that large restrictions on some people, athletes, people live in different climates, whatever, may actually be harmful. So that we take an approach that considers that it may not be one size fits all on it. And I know, public health approaches frequently are one size fits all, but let's keep in mind that may not be the best for everyone, and I would like the FDA to take that in consideration. We obviously know that we have a problem with obesity in the country, no question about it. It leads to a wide variety of issues, including diabetes. We've had these public focuses, on and I still remember, as you probably do, when eggs were bad, but now they're good. When margarine is good, and now it's bad. And now we're going to turn our attention to sugars, and we're going to talk about added sugars versus non-added sugars and things like this. And just ask that don't lose sight of the fact that a single nutrient approach hasn't worked in the past. I don't think it's going to work in the future. We need a much more probably complex approach than that, and take that in consideration. There is some concern that when the FDA implements rules that there's this protection of food-related trade secrets, and whether or not the FDA has adequate protections. You have statutory obligations to protect trade secrets, and I hope that when you ask various regulated entities to share trade secrets with you, that they stay protected. These industries, again, concerned about that. Finally, the last thing is the regulatory impact of food labeling. I mean, look, I think everybody agrees that food labeling is a good thing, but that the time frames for implementing food labeling really have to take into account that there are 300,000 food products on the market. It costs a certain amount of money to change food labeling. Again, I have, one of the largest bakeries, H&S, is in Maryland. I'm very, very concerned that there won't be an adequate time frame to initiate the new food labeling requirements, and that they're not done. There'll be one change this year, and then you'll decide, well, there's going to be another change next year, and you have to take industry into consideration so that we don't harm industries as we make progress in these topics. So with that, I think my time is, I think I have I guess I have a minute left if you want to address any of these.
Well, I'd look forward to following up with you on all of them. I'll pick up where you left off. We're sensitive as well to the issues around the timeframes on the implementation of the nutrition facts label and food labeling, and are going to be taking a hard look at the implementation schedule. I will say with respect to dietary fiber, we've been working through the petitions we've been receiving, and also plan to put out guidance to better clarify how sponsors can bring forward those new fibers. I'll just pick up on the other point you made, since we're on this realm, with respect to sodium and 10-year targets. I think you addressed. We won't do anything until the National Academy's report is ultimately issued. There won't be any, and it has completed its review, and so we'll look forward to following up with you on that and continuing that discussion.
Thank you very much. Yield back, Mr. Chairman.
Mr. Bishop.
Thank you very much, Mr. Chairman. I've got two lines of questioning. The first I want to get right into, and I will offer to submit the question in writing with some background material. This relating to compounding. The budget justification asserts that you're unaware of any compounded medications needed for office administration that are unavailable from the large outsourcing facilities. It's my understanding that healthcare providers who've been getting their compounded medications from local pharmacies have been unable to get many of these same medications from the outsourcing facilities in limited quantities and short time frame that they need in order to meet their patients' needs. And because the FDA has taken the position that local pharmacists cannot compound for office use, this is creating a problem of patient access to these critical medications. I applaud the exhaustive work that's been done on trying to reconcile this issue to find a solution that balances public safety and patient access. I was provided a list of dozens of compounded medications identified by pharmacy and provider groups, highlighting what they cannot get from the large outsourcing facilities. Are you aware of this list? If not, I can provide it to you, because I'd like for FDA's review and policy on office use of compounding by local pharmacists to appropriately balance public safety with patient access. And I will let you submit that to us in writing, but I will also be happy to provide that list of compounding compounds for you. My other question, which I'd like to spend more time on, relates to the subject matter of e-cigarettes, which my distinguished ranking member discussed in her questions. I wanted to thank you for announcing the 90-day delay in the requirements of the final deeming rule to allow additional assessment time, particularly in light of the numerous legal challenges and the final deeming rule. As co-author of the Cole-Bishop Amendment, the topic is near and dear to my heart, and we believe it will help to address many of the public communities, the public health community's concerns about youth access to e-vapor products. I'm a strong advocate for getting it right the first time. Not sure that 90 days is enough time for the deeming review. If so, that's great. But I would like for you to describe for us how FDA and HHS are reviewing the final deeming rule. Public Health England and the Royal College of Physicians both conclude that e-vapor products are 95% less harmful than combustible cigarettes. The predicate date in the deeming rule creates a severe problem for existing e-vapor companies, and not changing the predicate date will result in e-vapor products having more onerous and costly process to come to the market than cigarettes have. I don't know if we really want to stifle innovation in a product category which is 95% less harmful and is effective in moving people off cigarettes. I have numerous constituents who are being referred by their physicians in an effort to stop smoking to the e-vapor products. And many of them testify that they, in fact, have found that to be the most feasible step for them as they get away from the combustible tobacco products. The Cole-Bishop legislation actually would protect what I think the public health community wants to, require keep out of reach of children, and underage sale prohibition language on the label of the products. It would restrict advertising only to publications that meet the FDA's existing regulatory criteria of an adult-only publication, prohibit self-service displays, require nicotine content to be labeled, require vapor retailers to register with the FDA, require FDA to issue a final product standard for vapor product batteries. All of this, I think, is designed to help foster the protection from youth and at the same time protect the public health. Can you comment on that, please, sir?
Thank you, Congressman. Look, I believe in congressional intent, and I think that there's a reason why Congress wrote 2,400 words into Section 911 of the Tobacco Control Act, because Congress intended for there to be a pathway for modified risk products, and I think that there's a place for modified risk products in the risk continuum and helping smokers move off of combustible tobacco, which we know kills, onto products with lower risk associated with them. As I mentioned, I'm still working through these issues, and I want to make sure that I am fully grounded in the facts before I begin a policy discussion, a substantive policy discussion with the career professionals inside the Tobacco Center, and I'm still working through that process, having only been at the agency for 2 weeks. But I can assure you whatever we do in this regard is going to be science-based and is going to be dedicated towards the long-term goals of the Tobacco Control Act. I don't know if I have 60 seconds to address the first part of your question on the compounding. I'd be happy to do it. But
This is an important issue, so go ahead and take it.
yeah, I appreciate it. So I deeply respect the role for the practice of pharmacy. I think it provides critical differentiation for patients, but we have seen in the marketplace bad actors operating under the guise of a pharmacy license with tragic outcomes, and DQSA was a response to that. I think ultimately the question we're going to need to grapple with in this regard is the prescription the line of demarcation for regulation? I believe it is. Historically, it has always been the line of demarcation for the practice of pharmacy. I think if we want to revisit that as a matter of regulation, we're going to have to revisit it as a matter of statute, because the statute, in my interpretation, clearly defines the prescription as the line of demarcation for the legitimate practice of pharmacy. But make no mistake, I believe in the practice of pharmacy and the local practice of pharmacy, and I believe that compounders do provide critical differentiation when compounders are practicing local pharmacy.
Thank you.
Mr. Palazzo.
Thank you, Mr. Chairman, Commissioner. Thank you for being here today. Commissioner, over the past decade, the worldwide consumption of fish and seafood has increased 17%. This means more seafood is being imported and exported around the world from more countries into the U.S. According to a CDC study reported in February, 97% of fish and shellfish consumed in the United States are imported, of which the GAO estimates only 2% is inspected by the FDA on an annual basis. Although the number of foodborne illnesses outbreaks reported per year dropped by more than half from 2000 to 2014, during the same time period, the number of outbreaks reported from imported food doubled. In the same period, the CDC reported that fish and shellfish were responsible for 55% of outbreaks and 11% of outbreak-associated illnesses. I think we can safely classify seafood imports as high risk. However, this is not a new issue. Here's what I know, and as mandated by the 2011 Food Safety and Modernization Act, FDA and USDA, and the Institute of Food Technologies conducted pilot projects for improving product tracing and record-keeping requirements for high-risk foods. The report was released on March 4, 2013. The report contains recommendations to FDA for improving the tracking and tracing of food and also establishes best practices. I know that the seafood industry has used the Global Food Traceability Center to survey best practices, so I know they are reputable. I also know that this is still a huge problem made evident in the CDC study I mentioned. What I don't know is what FDA did with those recommendations and established best practices. Now, correct me if I'm wrong, but FDA has not issued a final rule to implement the recommendations made in these pilots and studies, the very ones that were mandated by Congress and commissioned by FDA. Now, Commissioner, I'm a firm believer that the Gulf Coast produces the best seafood in the world, so having tainted imported seafood saturating our markets is a big concern for me. Now, I understand that FSVP puts the pressure on importers to audit and verify the safety of the foods, but without this traceability portion of the FSMA food safety mandates, how do we know if the foreign suppliers are actually the source of the seafood being imported? So my question to you is, if you have not already, when does FDA intend to utilize the work that has already been done and finalize these food traceability rules to improve the safety of our food system?
Congressman, thanks for the question. I'd be delighted to follow up with your office and work with you on some of these provisions. It's not admittedly an area that I have had the opportunity in the last 10 days to sink deeply into. I will tell you that thanks to Congress, the FDA has vastly greater authorities with respect to foreign imports. We have extraterritorial jurisdiction owing to FDASIA and greater ability to enter into multilateral collaboration with foreign bodies to help augment our food inspection system more broadly. So I think that we're operating off a much better platform to achieve many of the goals that you've outlined in your question. And I'd be happy to work with you on achieving them.
Okay, and I look forward to working
Thanks
with
a
you,
lot.
Commissioner. I yield back.
Mr. Laurel.
Thank you very much, Mr. Chairman, and Dr. Gottlieb, welcome this morning. It's a pleasure to get a chance to meet you and talk with you. Two very, very quick things, because my colleagues have covered this. I just want to say that your proposal for a user fee increase, quite frankly, is not going to happen on both sides of the aisle. We've been dealing with that for a very long time, and I'd also like to associate myself with Mr. Palazzo's remarks with regard to food safety, an issue of which I've spent a lot of time on over the years. But what I want to do is focus my time on what your interest is to reduce the agency review times in terms of approvals, whether they be for devices or for drugs. FDA has already been reporting faster review approval periods, and that Americans have access to new drugs sooner. This has come at the cost of rigorous scientific evaluation. Approval of medical devices on limited scientific data can have life-threatening consequences. I'm going to give you several examples. 13 models of St. Jude's defibrillators are currently being recalled for battery failure linked to 2 deaths, people fainting, people feeling dizzy, sudden and unexpected failure of the defibrillator battery. 200,000 people in the United States have a defibrillator included in the recall. These medical devices were approved without any clinical data under an already existing FDA expedited pathway. The risks of the device were known for 22 months before the FDA issued any formal safety communication. Further, GAO has reported that FDA's medical device approval process underscores that new devices do not need to be proven as either safe or effective before consumers begin to use them. That's the defibrillators. There are others. We've a recent article, deadly form of cancer being linked to breast implants. Essure, a contraceptive device, more than 16,000 adverse events reports filed by doctors and patients. In each one of these cases, FDA has failed in its responsibility as a regulatory agency. You've refused to take corrective actions to protect consumers. There's also the issue of faulty lead tests, which recently FDA announced that certain devices have been found to provide inaccurate results, jeopardizing the lifelong health of 8 million Americans who utilized the tests. They went through the FDA's 510K pathway program. I know you want to speed up the process. There are others who want to speed up the process. First, I want to know is, what are the regulations that you would roll back to accomplish the goals of reducing barriers? Why does the FDA, and not you because you're just there, you're there for 2 weeks, but this is, quite frankly, an agency that has a history on erring on the side of industry and not the public, refuses to pull faulty devices off the market? Will you use your mandatory recall to deal with that? And why do we continue to use a pathway that has been proven ineffective in ensuring patient safety? A lot of questions, not a lot of time to answer them, but I will submit for the record as well.
I'll use my 15 seconds if I may, Congresswoman. I appreciate the
Chairman,
question.
give me a little bit longer
Thanks
time
a lot.
here,
I appreciate the
people are dying.
question and the concerns. I'd like to go back to the original premise of the question and the issue of speed versus safety. I think that the what we need to think about isn't speeding up the review process or speeding up review times. We know review times are very short, and the agency is very efficient in terms of how it approaches the review of applications. I think the question we need to be asking is the overall efficiency of the development process itself, and do we have the right tools? Are we asking the right scientific questions to make sure that that part of the process isn't just efficient, but we're learning all we can about both the safety and the efficacy of products in the development process. And that's where I'd like to focus attention, making sure that we have the right guidance in place, the right rules in place, the right scientific tools in place, and we're working with the broader scientific community to make sure that we have the right framework in the drug development process and the medical device development process to make sure that it's not only efficient, that we're not imposing costs without benefit to consumers, but that we're learning all we can about both the safety and the benefit of new products. And I think that there's more we can do in that regard. That's the framework in which I've always talked about trying to make the drug review process better. I haven't talked about speed historically. I've talked about the efficiency of the development process.
I understand that, but you've got some products that are on the market now that have been demonstrably putting the public health and safety at risk. My question to you, and you can't answer them now because we've run out of time, but we need to know from you what this agency is now going to do. It has a past history of erring on the side of industry, not recalling products, waiting 22 months before we do anything about a product. We need to act on those products we now know are putting people's lives in danger.
I'll be happy to follow up with you on
Thank you.
this.
Mr. Yoder.
Thank you, Mr. Chairman. Dr. Gottlieb, welcome to the committee. Appreciate your testimony this morning. I'd like to associate myself with the comments of Mr. Bishop, Mr. Harris, and partially Ms. Lowy on the issue of the Tobacco Control Act. You know, the act itself had some unintended consequences, and I think we're seeing those play out here as first of all of us, I think, on this committee strongly agree that we must keep tobacco products out of the hands of kids and that we need smart regulations to do that, and we appreciate your leadership in that regard. But in some ways, we're actually regulating, as Mr. Bishop laid out, e-cigarettes or vaping products more significantly than combustible cigarettes, which I don't think was the intent. I don't think that's what Congress wanted to do, and I think you saw this committee with the amendment it passed last year with the Cole-Bishop amendment try to fix that. You have significant regulatory authority. I think where we are now is we are created some real uncertainty in our community in terms of the regulations relating to stopping kids from receiving e-cigarettes, but also the deeming rule and the regulations that are affecting these new products. And so I guess, would you be willing to consider reviewing this and extending this deadline beyond the 90 days, maybe to a year, to allow the committee to continue to advise the FDA on how we think you should proceed, and to create more certainty and not rush this process and really over-regulate products that I don't think was the intent to over-regulate them more than we're regulating cigarettes. And so I'd ask, one, if you'd be willing to extend that deadline and to review the process using a regulatory authority. Secondly, on the issue of keeping products, tobacco products out of the hands of children, we know that premium handmade cigars are also a product that really is being over-regulated in a way that does not help keep products away from children. The deeming rules, one-size-fits-all regulations in this regard, are actually causing job losses, uncertainty about the future of many of these products. And so I'd also ask, would you be willing to reevaluate the overreach of the Tobacco Control Act as it relates to a one-size-fits-all model that affects this very small industry that is different than cigarettes, that is different than other tobacco products, and doesn't fall in the hands of children?
Thank you, Congressman. In my discussions with the leadership of the Tobacco Center, I am fully aware that a lot of thought has gone into precisely the issues that you outlined by the career leadership in the Tobacco Center, and they share your concerns, and I share your concerns. Whatever we do with respect to the deeming regulation and the 90-day pause that's in place right now and how we go forward after that is going to be based on our own scientific evaluation of what is the best pathway to make this framework sustainable for the long run in achieving its public health goals. And that's the touchstone that I'm going to be entering into policy discussions with the leadership of the center once I feel I'm firmly grounded in the facts and the decisions that have been made to the point to date. With respect to cigars, whatever we do needs to be science-based here. We're currently reconsidering aspects of the rule, as you know, and I understand the concerns that have been voiced. And and we're going to be having a discussion around those concerns. And if Congress acts, I'm also happy to work with you to mitigate any unintended consequences that might flow out of the effort to try to address some of the concerns that you raised.
Thank you, and I appreciate your leadership and your consideration to the comments the committee's made in the work of Congress and trying to have smart regulations. I wanted to ask you quickly about the 21st Century Cures Act we discussed earlier this week. Your leadership to ensure that the 21st Century Cures Act is a very bipartisan bill, strongly supported by Congress, that the dollars that go to the FDA, that those are appropriated properly. Can you talk quickly about the Oncology Center of Excellence and work that we can do to make sure it gets the resources necessary to carry out its mission?
Right. So I believe the model that we've created with respect to the Oncology Center of Excellence could be a regulatory model going forward for how we think about a broad range of therapeutic areas. I think the idea of trying to consolidate different domains within a center of excellence in that way makes a lot of sense in certain therapeutic areas, and oncology is probably the one that's most prominent in that regard. Obviously, what we do in that regard also needs to be resourced, and there were some resources that I believe were intended to be allocated to the Oncology Center of Excellence that haven't flowed to the center yet. And so I'd be happy to work with Congress to make sure we can properly resource that, not just because I think it's vitally important that we make that center viable, but I do believe that there is a more sustainable model for how we might regulate therapeutic spaces more generally. And if we get it wrong in this first instance, then we can't skate towards that goal.
Thank you for your testimony. Mr. Chairman, this is an issue that we need to resolve, and there are dollars that we intended to get to the FDA to create these oncology centers of excellence, to get drugs to market, to help people who are suffering from cancer, and because of basically technicalities, it's not happening, and so I think this is something we need to really take up and fix.
But happy to follow up on it. Mr. Pocan.
Thank you, Mr. Chairman, and welcome, Commissioner Gottlieb. I really enjoyed hearing some of the things you said at the beginning in your testimony about worried about people being priced out of prescription drugs and some of the work that you're talking about on generics. And I'm going to come back to that in a minute. If I can just do two other subjects. I think one really quickly, hopefully. Before you were there, 2014, there was a problem that we had with the FDA when they were trying to ban the aging of raw milk cheese on wood boards. Talk about a small issue, but in my district, it's a very big issue. This was a bipartisan outcry from Congress, working with some of the other stakeholders. We were able to get it put on pause. The only problem is I had a very unproductive circular conversation with the former deputy food commissioner within the FDA, who would not give me a concrete, we're not going to keep going after this. There were no health problems whatsoever. There were a couple ordinance violations. I've been in many cheese facilities and where they're doing it on wood boards. Just want to know, is this an issue that you're done trying to ban or trying to increase regulation on the aging of cheese boards that's been done for centuries?
As a consumer of artisanal cheese, I share your concerns around making sure we have an adequate.
Good answer already.
But it's an issue that I'm aware of, and I'm happy to follow up with you and delve deeper into it. My current understanding is that wood boards can be used as long as they're adequately cleanable and properly maintained for their intended purpose. So there is a framework in place to allow them to be used. Whether or not that is having unintended consequences on certain manufacturers, I'm happy to try to work with you on this issue.
Great, I appreciate that, thank you. Another issue, and the only other issue I kind of had a little conflict with the FDA in the past on, was an issue around a plant called Kratom that was being by the DA was trying to put as a Schedule I drug because they said because of FDA actions saying that there were problems with kratom. This is a plant that we're finding a lot of people with PTSD and opiate addiction especially are getting weaned off of opiate addiction. Through this process, Mr. Salmon from Arizona and I led a bipartisan letter, 35 of us, and was almost 50-50 bipartisan. It was a really strong bipartisan letter to try to get this to stop the scheduling of it as a Schedule I drug. Since then, that's happened. They put it on pause, but they're waiting for the FDA to do an 8-factor analysis, which has, I think, already been done by people from the Kratom Association. I think this all started, quite honestly, because there's a synthetic heroin that one of the components people were using was kratom, yet this has no addictive properties that any study has shown. Where are we at on this 8-factor analysis, and has the FDA changed its position on some of the earlier claims they had on that kind of led this to becoming a Schedule I?
Thank you, Congressman. I think you rightly noted FDA in 2014 expressed concerns around the product based on the potential for toxicity to multiple organs. And the 8-factor analysis that DEA asked us to do in 2016 is currently underway. I actually don't know currently what the status is. It's another question I'd be happy to look into and follow up with you on, but I know it's underway within the center.
Great. And then the final question, just to go back to the generics, one of the other issues I know is there's this pay for delay by some of the companies that's going on when it comes to generic drugs. Are you looking at that issue as well?
I think that that's probably an issue more for, I believe, the FTC. What I will say is that, as I said in my opening remarks, I'm concerned that there are places where I believe certain companies might be gaming the regulatory process in ways that Congress didn't intend, to extend exclusivity periods beyond what Congress intended. And if we're going to balance innovation and access and have a place for market-based returns to bona fide innovations, we need to make sure that there's the capacity for market entry of competition after patents have expired, patent periods that Congress intended. I don't want to be in a position of playing whack-a-mole with companies. What I want are clear rules and bright lines in place that prevent these kinds of abuses. And so we're going to be having a hearing, a Part 15 hearing soon, to try to solicit these ideas from the consumers and the broader public on where these things might be happening. Sorry, Mr. Chairman.
Thank you very much.
Mr. Valadao.
Thank you, Chairman. Thank you, Commissioner, for taking some time, and congratulations on your appointment. Food Safety Modernization Act, FSMA's purpose is to shift the focus of food safety towards prevention. I believe this is a positive approach for producers, processors, and consumers. However, it is important that implementation is done properly in order to avoid unintended consequences to the supply chain that do not improve food safety. With the understanding that the foundation of FSMA is based on risk, there is a concern over the definition of farm and whether it is consistent and accurate in accounting for risk. I have heard from my constituents in the tree nut and cotton industries who have expressed concern regarding the flaw in using ownership of the commodities that are hulled, shelled, and ginned at their facility as one of the determining factors for secondary service activities farm. This inconsistency is of great concern to my constituents who grow and process these products, and I am under the impression that it is likely to cause mass confusion among industry and regulators. What is the best way for FDA to address this issue, and do you believe guidance is sufficient, or is opening up the rulemaking the only option? And the compliance deadline for the produce safety rule is roughly 8 months away, January 2018. Will this farm definition issue be addressed in a timely manner, allowing the industry enough time to get compliance measures in place? And if clarity is not reasonably provided prior to compliance date, will compliance date extension be given for the produce rule, given the lack of guidance as how to apply to the rule?
Congressman, I have to confess this isn't an issue that I've broached in my first 2 weeks on a job. I'm happy to follow up with you on it and see what the issues are, better understand the issues, and see what we can do to accommodate any concerns that you might have and others might have if it's causing unintended consequences.
Yeah, it's a serious issue, and it's literally the definition on how the ownership or what the ownership of a facility is, and there's no reason for the ownership to play any role in how to regulate it. So I appreciate.
Happy to work on it.
Thank you. And then another one, the Omnibus Budget Agreement for fiscal year 2017 that was just signed into law contained report language expressing the committee's concern regarding a draft guidance on compounding from bulk ingredients for animal drugs, the GFI number 230. I appreciate the response to this report language included in the budget justification, which seems to indicate that it is attempting to apply provisions similar to 503A and 503B to animal drug compounding, even though these provisions are limited by statute to human drug compounding. Can you provide the committee with specific statutory provisions that support the implementation of GFI 230 for animal drug compounding, and does the FDA plan on requesting statutory changes to support these protocols?
Again, Congressman, I'm generally familiar with the issue, but in the interest of making sure I don't misspeak before Congress, I'm probably going to defer and let you know that I'd be happy to work with you on this issue. So I appreciate the question, and will follow up with your office.
I look forward to seeing your follow-ups on these.
Thanks
I know
a lot.
they're both important issues, and I'd love to get
Thanks a lot, Congressman.
response on that. So thank you, and I'll yield back the rest of my time.
Thank you. Ms. Pingree.
Thank you very much, Mr. Chair, and welcome, Dr. Gottlieb. It's nice to have the chance to have you before our committee, and I appreciate you being here today. I'm sorry I was in my other committee and I didn't get to hear your opening remarks. I will follow up with that, make sure I connect on those, and I'm interested to hear more of what you had to say about drug pricing. It's an issue I've cared about for a very long time, going back to when I was a state legislator. And we don't have time to get into the topic today, but particularly on the topic of reimportation of drugs from Canada. I'm from Maine, a border state. I've accompanied many busloads of senior citizens who've taken that trip across the border, gotten a duly licensed physician to rewrite their prescription, and bought virtually the same drugs in Canada for a much lower price. And drug pricing overall, our inability to negotiate for better pricing is a huge issue. The president has brought it up several times, so he seems to be willing to talk about this, yet there was nothing in the budget around it. And I know there have been safety concerns raised about prescriptions being filled in Canada. It's a much longer topic, but I'd be interested in taking that up with you at some point, and I will submit some questions for the record around that. Just a couple of other topics, and I appreciate you've only been there for 2 weeks. This is a lot to absorb, and I know you already know a lot about it, and you've given some very detailed answers already today. But I'm going to bring up 2 other topics that I'll submit to you and we can follow up on later, because I'm pretty sure you're going to say, as you did to my colleague from California, you don't have a lot of experience with the Food Safety Modernization Act. I've worked quite a bit on the issues of how that is practically applied to farmers. I represent a lot of small to medium-sized farmers, and I have a farm myself. So the implementation is close, and working with the department to make sure it's not a one-size-fits-all plan has been really critically important, and it's something we've focused a lot of attention on. Food safety obviously is critically important to us, but if you have 3 rows of lettuce, it's different than having 1,000 acres of lettuce, and the application has to be different. There's some outreach and training efforts going on right now, and I just will say in advance, I don't expect you to know the answer to this question, but we're, with the deadlines coming up soon, the training issues for farmers are very critical. This is complicated stuff to learn, and everyone wants to be in compliance with the law when it is out there, but for a lot of small to medium-sized farmers, there's just not enough time, and we're waiting on FDA to provide some alternate curricula guidance, and I'm anxious to know when that will be out there so more of the training can be developed. And like I said, I don't expect you to know that answer today, but it's a specific question. But it means a lot to a lot of organizations who are hoping to do some of that training, and particularly the farmers who need it. Secondly, I want to just talk to you a little bit about food fraud, which is actually quite a big issue, and specifically, just right now, I want to talk about maple syrup. It's about a $15 million industry in my state. We, of course, think that we have the best maple syrup, no matter what Vermont says. Our producers yielded about 675,000 gallons of maple syrup last year, so it's an important industry to us. In 2016, I sent a letter to the former commissioner with some of my colleagues about maple syrup fraud issues. Frequently, cheap, industrially produced sweeteners and artificial flavors are added to products, yet they still have a real maple syrup label. So you can imagine that consumers who pay a premium price don't want to think that their food is adulterated, or in fact it's not what they purchase. So again, I'm going to run out of time, but I'll send you that more detailed question in writing. And I also have a lot of concern about the cheese board issue, because we have a lot of cheese producers in our state as well. So you've got 3 seconds.
Thanks. I'll just say quickly, as someone who produces his own maple syrup, but I live in Connecticut, I'm not subject to FDA's regulation because I'm an individual manufacturer, and also I raise 7 egg-producing hens. I'm sympathetic to the concerns of small farmers and producers, so I'm happy to work with you on these issues, particularly the maple syrup issue.
Great. Well, we will follow up with all of that, and we're thrilled to know that you're agriculturists in your spare time.
Thank you.
Mr. Young.
Thank you, Mr. Chairman. Welcome, Commissioner. Nice to see you here today. I share many of the thoughts that many of my colleagues have brought up today. The food labeling issue, thank you for taking the extra time to get that right. And just following up on my colleague from Maine, Ms. Pingree, regarding prescription drug costs. All of us hear about this from our constituents. I've had roundtables with doctors and nurses and hospital administrators and specialists there, and you hear this everywhere, and pharmacists in a lot of ways too. We've seen spikes from EpiPen to insulin. How do we address this issue? And I understand competition, and I love competition, but it seems to me that without transparency, how can you really have competition in that sense if you don't really know what the pricing is out there? And so Can you address things like transparency in the pricing of prescription drugs and as you talk about the FDA review process and the approval of drugs, and we want these drugs to be safe when they're approved. What are your comments and criticisms about the current process right now?
Thank you for the question, Congressman. I think where FDA can play an important role with respect to the drug pricing issue more broadly is in making sure that we have adequate product competition, especially when exclusivity periods that Congress intended have lapsed and drugs should be subject to vigorous competition. I think in some of the cases that you highlight and some of the cases that I would highlight, we all have our own personal examples of where markets aren't working efficiently. There's different problems at work. I mean, in some of these cases, it's issues of complex drugs that are hard to genericize under current scientific standards. I think there are things FDA can do from both the policy and scientific standpoint to facilitate to market more generic competition to complex drugs, and that's where we've seen some drugs sort of be monopolized in perpetuity because it was hard to bring on generic competition. I think there are issues with just the overall efficiency of the generic drug review process itself historically, although it's gotten a lot better, and the commitments that the agency is making now are for very rapid review times, but we do have situations where speculators, for lack of a better word, can come in, buy a low-volume generic, jack up the price, knowing that it's going to take potentially years for a generic competitor to come onto the market, and so they have sort of that exclusivity period. So we need to make sure we're prioritizing applications in those cases. We intend to do that, and also making sure the generic drug review process itself is working as efficiently as possible so that competition can enter.
Now
and then there are these...
We're due to reauthorize the generic drug law here very soon, and I hope that you will bring forth some ideas that you think could work better. Now, you talk about, within current laws and in some places, we need to clearly brighten that line where there's no, and highlight it because you think maybe some companies may be out there gaming the system and you don't want to mention them publicly because you don't want to play whack-a-mole. But I think there's a power in shaming, and Congress has proved that before. Industry has proved that before. Our constituents have proved that before. Sunlight is the best disinfectant, right? And to put people in place and try to get to a better behavior. So don't be so shy about playing whack-a-mole sometimes.
Well, I'd be happy to work with you in a shaming initiative if you want, but
I'm sure you can. But this is a serious issue that all of our constituents hear about, and we want to make sure that they are given safe products.
I agree.
But as well affordable as well, because many are choosing between some of the most important things in life, sometimes food, sometimes their rent check, and their medicine.
And with respect to legislation, and I realize how serious this issue is, that's why this is one of the first issues that I'm trying to tackle in my first 2 weeks on the job.
Thanks for that priority.
There are things that I think we can do administratively, but potentially Congress can do better. And if there are areas where new statutory definitions or frameworks can be helpful in trying to achieve some of our goals and making more competition available to consumers, I'd be delighted to work with you on that.
I think Congress in general would like to work with you on that.
Thanks a lot.
Mr. Chairman.
Thank you, Mr. Chairman. We successfully got through one round, and they've called the votes, but we'll go for just a few more minutes before we have to leave for votes. I want to follow up on where I left off about the orphan drug. I want to hear your thoughts on another more specific subject about drug approval process, the orphan product review for rare diseases, and the dramatic increase in the number of orphan drug designations requested and some rather unusual approvals. In particular, tell us about the situation, or what's your thoughts on the situation with Marathon Pharmaceuticals and how it can be fixed, because it's very hard for us to go and explain to our constituents, whether it be in Maryland or Wisconsin or Alabama, that where a mother or father has the only way that their son can get to improve their quality of life from the terrible effects of Duchenne is if they spend over $89,000 a year versus $1,000 a year they were paying the year before. So if you could, your thoughts on that, we would appreciate hearing.
Thanks a lot, Congressman, for the question. I mean, there is an issue a statutory issue with respect to a whole host of drugs that are unapproved drugs currently, that when they do come in for FDA approval, under current statute, they are entitled to NME exclusivity. They are entitled to a period of exclusivity. That's the current framework. And, you know, periodically, there's a number of drugs that continue on the market and continue to be sold that aren't FDA approved, and periodically drugs will come in for approval and gain exclusivity, and then you'll see high prices sometimes result. Monopolists will behave like a monopolist when it has the opportunity. I think that this is a difficult issue because we try to strike a careful balance between having drugs that are FDA reviewed. Congress wants us to do that, but also concerns around the situations that you highlighted. And I'd be happy to work with Congress on this. I know from my prior experience at the agency, periodically the agency will get criticized for the fact that there's a lot of these drugs out in the market that aren't FDA approved. And then when we bring them in for FDA approval and they gain NME exclusivity, then sometimes you see prices increase. And so there's a very difficult balance there between safety and access that I think needs to be struck, and I'd be happy to work with you on that.
I think you're going to yield to Ms. DeLauro.
I am. Mr. Chairman, I'd just like to request that I be allowed to submit my additional questions for the record. And with that, I would yield my time to Mr. Laurel.
Yes, and because I think all of us have had limited time because of the vote schedule, we'll leave it, if anybody wants to submit questions for the record, that will be fine. So, but Ms. DeLauro, go ahead.
Thank you, Mr. Chairman. Many, many thanks to the ranking member for his courtesy. I, too, will submit and follow up on the questions that I already asked on the safety issue versus the approval process. I think it's critically important these days. Let me move to something that a couple of my colleagues have mentioned, and that's food safety. The budget is $119 million in a cut, roughly 9%. No mention of FSMA funding in the budget, which is very, very troubling to me. The agency has finalized 7 of the rules and conducting outreach to ensure that the stakeholders understand the new requirements. I think it's I want to get your view. You're both domestically and internationally, we are shortchanging our ability to inspect and to review the safety of our food products. I believe that the budget not reflecting a 9% cut, $119 million, is short-sighted. Do you agree that that's a short-sighted approach?
Congresswoman, I wasn't, as you know, I wasn't involved in the formulation of the budget. As the new commissioner of the agency, I'm going to do everything I can to work with the administration and in particular work with Congress in this committee to make sure that the agency has the resources it needs to fulfill its mission. And there could be perhaps no more critical mission than food safety because of the potential for distributed harm if we get it wrong and if something does go wrong with the food supply. So this is something I'm extremely focused on and have spent time talking to the leadership of CIFSA on how we could continue to move forward in implementing FSMA and making sure we fulfill the intent of Congress and protect consumers, whether this budget is enacted or we work with Congress to make sure that we have the right framework in place.
I'm just going to express a view to you, which I've had from the number of years I've served on this committee, and that with the mission of the FDA, with food, drugs, devices, and tobacco, that in the past, food safety has become a stepchild at the agency. In addition to which, it has struggled to get the resources, and I would just say I'm proud of the time that I spent as chair of this subcommittee to increase resources, a whole number of areas, but including the food safety issue. We spend foodborne illness causes $36 billion a year in medical costs, 3,000 deaths, 128,000 hospitalizations, 48 million foodborne illnesses every single year. We know the answer to this issue, and not providing the resources to deal with this because of its potential result. This is not a road, park, or bridge. This is about people's lives. On the international side of this, and I don't know what the hiring freeze, and you might want to address that, has done to an inspection regime that you have. But we inspect less than 2% of the product that comes in from overseas. And you all have the bulk of the jurisdiction with regard to food safety. So that wherever the decisions were made on this budget, my hope, and I'd like a commitment from you and continue to have this conversation, that this lack of focus on food safety by this agency will change under your directorship of it.
There'll be no lack of focus by me, Congresswoman. I can assure you that the hiring freeze was lifted at 9 a.m. this morning. I sent an email out to the staff informing of that. I was at FDA during a period of time when I believe the food program was under-resourced and we didn't have adequate authorities. And thanks to Congress, we now do have much more robust authorities and resources. I don't want to go back there either.
And I want you to be able to use the authorities. Sometimes there's been reluctance to use the authorities when it comes to food safety. Thank you, Mr. Bishop and Chairman Aderholt.
Yeah. Well, certainly, I think this committee has been very committed to funding for food safety, and I think the record will show that. And I did want to go on record and say that. But let me just say thank you again, Commissioner, for being here. Sorry we've had a little bit condensed session today because of votes. As I mentioned, votes have been called, and so there's about 4 minutes left in the vote. So we'll go ahead and adjourn here so we can be able to cast our votes on the floor. So all the best to you. We look forward to working with you, and thanks for following up with these questions.
Sanford, thank you very, very much.